I guess that's everybody. So we'll just get started. Hello, everyone. Thank you for coming to our seventh meeting of our program. And today we have Dr. Deep Shah with us. And here yours floor.
All right. Hey guys, good evening. Thanks for having me. So I guess a little bit about myself. I am a board certified pediatric dentist who practices outside of the Philadelphia area. So I am actually two different things. I'm part-time in private practice, and then the other half, I'm actually in academia. So I teach at the University of Pennsylvania School of Dental Medicine. So it's been kind of neat to see both ends of the field from a private practice standpoint, treating patients directly, and then also in academia, working with the residents and kind of being up to date with all the subtle nuances that are kind of going on in the field of dentistry as well, which has been neat. A little bit about my journey. After high school, I did 4 years at Drexel University in Philadelphia. Upon culmination of that, I did 4 years of dental school at the University of Pennsylvania. And then I decided to choose specializing in pediatrics. And so what that entailed was another 2 years after dental school. So I went to the Children's Hospital of Pittsburgh, of UPMC, out in Pittsburgh, PA, and did 2 years there. And then ultimately came back to the eastern side of the state because I have family here. And so I've been through a couple of jobs. And so, I've worked in a small kind of family-owned dental office or dental setting, so to speak. I've also worked in a large corporation. So those of you, who are interested in dentistry and have questions, I guess, in regards to how a more private practice and a family-run business family-run business-owned operation kind of works and how it differs from maybe a more large-scale corporation, I can certainly, give you my intake and feedback on that. And then right now I'm working for almost like it's like a DSO, so it's almost like a corporation, but they're a lot smaller, has more of a family feel to it. But I'm content. I'm happy. I kind of hopefully I think I found my home in terms of being where I want to be long term. And then on the side of that, I've been in academia for the past year. So that's kind of been my journey to get me to where I am right now.
Thank you, Dr. Shah, for sharing with us. We're opening up the floor for questions now, so you can either drop it in the chat or you can just unmute yourself and say directly to the doctor. Can you see the chat window?
Let me see if I can pull that. I do. Let me see if I do. Yes, I do see a chat window. How competitive is the dentistry field? It's a great question. I think it is quite competitive. I think there's less dental schools out there than medical schools. And for that reason, the acceptance rate, if you look at numbers wise alone, it's kind of, can be a little daunting. So, to answer the question in a nutshell, it's quite competitive, but it's also very rewarding, just like anything. I think the biggest thing here is that it's just a takeaway and the passion and purpose and kind of choosing a field, whether it's dentistry, whether it's medicine, whether it's pharmacy, whether it's anything healthcare related. It's just, you have to have a purpose, a passion, and your why. And that kind of answers into the next question, which is, how do I know I want to be a dentist? And that's a great question. When I was younger, I was diagnosed with ALL, which is acute lymphoblastic leukemia. So I had that from the age of 2 till the age of 5. So I've been in remission since the age of 5. And it was during those visits when I used to go see my oncologist that I saw like a bunch of kids around me. And I was blessed and fortunate enough where I didn't have to go through chemotherapy and radiation, but a lot of kids that were around me did, and they're hooked onto IV poles. And that's kind of when I knew I wanted to give back to kids, because like kids are a clean slate. You can mold them, you can shape them, and you can kind of paint on them the way you want to, especially when they're young. And so kind of, if we all look at who we are right now, a lot of who we each individually are has to do with our childhood and our upbringing. And so I realized that, hey, I wanted to go into peds at that point. What got me into pediatric dentistry and not medicine, because I was medicine for quite a bit of my high school year. But then I realized that, hey, I'm ambidextrous. And I like instant gratification. And so I like the result of, hey, of people coming in discomfort and then leaving, right away feeling a lot better and feeling much better. And so dentistry to me offered that. And that's kind of the reason why I chose that field. Give me 1 second. My dog's right here. I'm going to get out of here. Boy, buddy. I love you, dude, but you gotta go. Sorry, guys. Let's see. The next question here, I guess, does it make sense for me to just go down this chat and answer these questions?
Yeah.
Yeah.
I'll do that. Um, so let's see. What attracted you to pediatric dentistry? That's a great question. I think it was the fact of working with kids, like I just said in my previous answer. They're a clean slate, and just to be able to help them with their fears and help alleviate them. Uh, the way I brand myself in private practice is I'm the superhero dentist, and so on Instagram, that's my handle as well. It's at the superhero dentist, and my whole mission in life is to help empower kids be their own superhero. And so I think each one of us has our own unique strengths, abilities, and especially kids, like they're just, they can go in any direction in life. And so my goal is just to help empower them be their superhero at an early age. And it starts off being, just being comfortable in the dental office and helping alleviate certain fears that they may have. So that's kind of, I guess, what attracted me to pediatric dentistry, and why kind of what I do right now. What does a daily work schedule for you look like? So for me, it kind of varies. I do a couple of different things. So my usual, I would say an ideal schedule that I really like is I come in. So my hours are 7:30 in the morning till 4 o'clock. And so I'll come in. Usually my mornings are, I'll do sedation. And so I got trained extensively in oral conscious sedation. So it's almost like giving kids a little medicine to get them into a twilight, so to speak. And it helps, these are for kids who are just need a little bit of cooperation, or they have a lot of work and just need a little extra time in the chair. And so it allows me and buys me enough time to take care of a lot of their dental needs at one visit. They come in fasting. So this is why I do this in the morning, because they come in, nothing to eat or drink since the night before. And then in between those, I'm seeing my hygiene patients and checking on, these are kids that come in for their cleanings. So I go in, do their exams. And the afternoon is a combination of continuing the hygiene and still seeing operative and seeing kids and treating, fillings and doing things of that nature, but more with laughing gas and, and doing consultations and things like that. My practice does entail frenectomies. So I will see kids as young as 10 days old who come in with a tongue tie, whether it's the lingual or the upper, and they're having a hard time feeding, whether it's breastfeeding or whether it's bottle feeding. And those have been some of the most rewarding cases, because when you see an infant being able to latch and eat right away and thrive, it just makes the mother feel good. And, obviously you can see that the child is just eating a lot better and uninterrupted. So that's something that I do as well. And the other thing I do is IV sedation. So I work with a dental anesthesiologist, and we have like one day a month where all I see is kids who we literally kind of, in a way, kind of put to sleep, and they're nice and comfortable. And I'm able to do a complete dental oral rehabilitation, which is just a big fancy word for me taking care of all of their dental needs in that one visit. And so that's great for a lot of our kids who just are maybe 3 or 4, have a lot of dental work, can't cooperate to take x-rays, and, just had to be fully sedated to take care of their dental needs. So that way they're no longer in pain. And so that's kind of what like a normal day for me kind of looks like. That's on the private practice side. On the academia side, I'm working with the residents. So I'm kind of doing the same thing, helping them develop their skill sets, helping them treatment plan, how to assess patients, how to look for certain things, and kind of sharpening and honing in on your skills. So what is the hardest part of dental school? Oh man, that is such a loaded question and such a great question. On many different fronts. Obviously studying, getting used to the curriculum and how much kind of memorization, how much you're reading, how much learning you're going to do, for sure. I think that's probably one of the hardest parts, just to kind of get used to, and to kind of get acclimated to, is just kind of getting in terms of your scheduling, how you're going to, train your mind to learn, and how you can prepare yourself and kind of soak in the material. Looking back at it, I would say that was in the moment. So that was probably me when I graduated in 2013. So when I was in dental school from 2009 to 2013, I would say that was probably the hardest part of dental school. Looking back at it now, with a different perspective, I would say the hardest part is taking everything you're learning to be factual. And the reason I say that is when you come out of dental school, every dental school is going to kind of push their curriculum or their thoughts on you. So to be able to learn something with an unbiased and a very open mind, in the moment is very difficult because you yourself don't really know what you're learning and what you're about to delve into. So you almost take your education at face value, but it's once you know, finish and you kind of are out of dental school and you practice and you're doing more reading, that your views and your thoughts might change. And to kind of go back and relearn some of the things you've already learned, that is to me sometimes the hardest thing as well, kind of out of dental school. So it's a great question, but there's two ends of it. What were some of the things that helped you stand out when applying for dentistry school? That's another great question. So unfortunately, I feel like in today's day and age, I feel like it's a lot of this is grades driven and like DAT score driven. And that's just the way that they can kind of separate you from every other applicant when you're applying to dental school. So I don't think there's much that has changed on that front, just because when you're coming out of high school is very easy to like be involved in like 8 or 10 extracurricular activities. And so my takeaway is, if you're going to dental school and once you're in dental school and you're applying to a residency, let's say, try to keep your extracurriculars, I'd say, quality over quantity. And that's my biggest takeaway here, is that if I'm on the admissions committee, I'd rather see an applicant excel at like 3 or 4 things, but having them done that for a longer period of time, rather than seeing them involved in 8 different activities, each for a year or 2. So I think that's the big thing. If you like research, that always stands out, you know, especially the same thing like with medical school and dental school, it's the same thing. If you are research driven, you know, if you're able to get published or have your name on a publication, that's huge, because that's just something that's rare. And other than that, I would say, just when you apply, stand out, be yourself. I think in today's generation, today's day and age, there are a lot more, you can kind of see the shifting of the guards. And what I mean by that is there's a lot more younger people that are going into academia. And so our mindset is very different. Like, sure, you got to work hard, but we also understand that there's a huge mindset component of this. And so when we have incoming residents that are applying to our program, sure, the grades are fine. I mean, at this point, I feel like, you know, if you're going to apply, you're applying because there's an underlying purpose. So my question to you is, what is your why? That's the biggest question in life that I feel like you just need to answer. It's, what's your purpose? What's your why? What drives you? And if you can answer that in any interview, you know, I think that's the biggest home run. And no one can argue with that, and with your inner intention and your inner purpose. What are the different residencies in dental school? That's another great question. There's so many. So there's pediatric residency, which is what I'm doing. There's orthodontics. There's oral facial maxillary surgery, OMFS. Then you have like anesthesia, dental anesthesiology. There's endodontics, which are like root canals. There's periodontics, which is like a lot of gum involvement. They have a combination of like perio and prost. And so prosthetics is kind of some like serious surgical cases as well. And you can also go into like kind of dental emergencies and kind of dealing with pathology. So dental pathology is like another subspecialty there. So I want to say there's about 8 or 9 of them, if I recall at the top of my head, but there are tons of options. And of course there's general dentistry as well. So if you don't want to specialize and you just like general dentistry and what that entails and what that brings, then you absolutely have that. And the benefit with that is you don't have to do a residency to become a general dentist. Did you have to get a PhD to start teaching? I did not, no. So here with teaching in peds or teaching at the university, did not have to get a PhD. Now, if you want to go into the tenure track and you're someone who's big into academia and wants to be, you know, publish papers, then, like I said, having a PhD, sure, I think it's just more of an ego boost than anything else. I know a lot of faculty that I work with who publish papers, they're not PhD, don't have a PhD, but they are driven by academia and driven by the research and the results that it produces. So in a nutshell, the answer is no, you do not need to have a PhD to teach. When did I realize I want to be a dentist? I would say I was in undergrad, and I'd probably say like my 3rd year of undergrad. I think that's when I realized I wanted to go into dentistry itself. So it was definitely a little bit later in the game. It's not, no one in my family is a dentist, so I didn't have any like family lineage of dentistry. But I think it was, you know, at that point when I realized, hey, being ambidextrous, loved using my hands, and then kind of what the dental field entails. I did do some shadowing before that and kind of see it. But like I said, I think I just love that instant gratification that the dentistry field brings. The other thing I really loved a lot as I learned more and more was the autonomy that you have. So I am not, I am not an employee of like a hospital. Although, I'm an independent contractor right now. So that's also something that you can do is you can be an employee or you can be an independent contractor. Or if you want, you can be your own business owner and open your own practice. So there's many different avenues that you can go with through dentistry. But I think the autonomy in terms of setting your own hours, setting your own schedule, that was one of the most enticing things that I personally also liked, because I wanted to have a quality lifestyle that allows me to just live life as well. I thought dentistry did a good job of balancing the work-life balance. Did you ever have to work during school, or was it strictly schoolwork? I personally did not work during school. It was strictly schoolwork. I was on a dance team in dental school. And I would kind of say that dance team was almost like a side job, because we'd have practices from like 8 p.m. to 2 a.m. in the morning. And so I did it like my first couple of years just because I had a passion to dance, and something I've been doing for a very, very long time. But some other things like, club tennis and some other passions that I had, I dropped. I mean, it's just, you realize you only have time if you want to do well in school and still have a little bit of a social life. You only have time for maybe one or two activities. And so it's really hard otherwise, because like I said, the amount of information you're learning and you're absorbing and you're taking in is quite a lot. And in order to do well and in order to just retain, it does take a little bit of extra time work and studying. And especially that first year, dental school is a little bit different the way it's kind of divvied up. Your first 2 years are generally very academia driven. So it's a lot of schoolwork. It's a lot of reading for exams. Depending on what school you go to, determines like your testing schedule. So when I went to Penn, we had exams every week. I think in a whole year, I think there were only 5 weeks where we did not have a test. Every other week we were tested. Now there's some schools out there that'll have maybe 3 or 4 exams every 2 or 3 months. And so you get a little bit more of a break, but then when it's time to have those exams, you literally have like a lot of people that it's like they call it hell week or exam week, because you're literally studying for 3 or 4 exams during that same week. So it just depends on the school and depends on the type of curriculum that they have in place. Can dentists prescribe certain medicines? Oh yeah, you can actually prescribe a lot of things, everything obviously within your scope, but it depends also on your, whether you're going to go on to use, and get a restricted 1 or a restricted, kind of 2 permit. Dentists generally, unless you're OMFS and have an oral surgeon, you're not going to get that restricted 2. I have a restricted 1, so I can prescribe many things. Now, do I usually do that? No, because working with kids, usually besides like children's Tylenol or Motrin, which is over the counter, I'm very, very, very rarely giving anything stronger than that. Your antibiotics and things of that nature, which are more common because of dental infection, those are usually the most common things you'll prescribe. I have prescribed, Vicodin as needed, with certain extractions, especially during residency when we're doing those things. But once again, in the pediatric realm, I'm definitely not prescribing that. Maybe Tylenol 3 every now and then, very, very seldom. But depending on the field that you're in, if you go into, as like I said, an oral surgeon, or if you are doing prosthodontics work or becoming a periodontist and you guys are doing a lot of implants and gum surgery, you're going to have a lot more of an adult population. So in those cases, you might prescribe, your Vicodin and things of that nature and your stronger painkillers. But other than that, no, it's usually nothing strong. So you can prescribe, but you also have a scope within where your boundary falls into. Are there things you wish you knew before pursuing dentistry? That's a really good question. Yeah, looking at it now, it's so funny. I'll ask you, I'll ask everyone this question. When you brush your teeth tonight, how many of you guys are using Colgate and Crest? It's something that I used to use a lot. So I'm going to raise my hand up and I'll be guilty of it. Now, the one thing where I've gone a lot more natural, and I've learned that, ingredients, we read them all the time when we eat foods, when we make nutritional choices. They're just as important when you're brushing your teeth. And it's something that you don't really learn in dental school in terms of how important, I mean, you learn how important oral care is, but you really don't learn the ingredients behind oral care. So here's a scenario that I tell you guys. If you look at the back of your Crest or your Colgate, you'll see a bunch of these ingredients. You'll see SLS, which stands for sodium lauryl sulfate. It's what causes your toothpaste to foam. It's a false illusion that we all have, including myself at one point, that, hey, my mouth and my teeth are getting sparkly clean. It's awesome. Like my mouth is bubbling. I know it's working. But it's also, if you get a lot of canker sores, that's the reason why you're getting canker sores, is that SLS. SLS is also found in your dishwashing detergent, in your laundry detergent, in your soaps. So it's something, like I said, as you don't really learn about that in dental school, but as you get out and you start reading and digging your own research, so you're like, aha, like that's neat, that's kind of interesting, that's different, and it changes your perspective on things. You also have things like carrageenan, which is a derivative of seaweed, which has been linked to certain GI issues and potential cancers. There's parabens, there's triclosans. So there's all these different ingredients that are in toothpaste that we use, which are, can be harmful. Now people are like, well, how is it harmful? What do you mean? So here's my takeaway. If someone has a heart attack, sure, you might give them baby aspirin, but if it's true emergency, they're going to get something called nitroglycerin. And where do you give nitroglycerin? Sublingual, right under the tongue. Think about this. Why are you giving something to someone under the tongue? Because your mucosa in the mouth is that highly absorbable, which means that it enters your bloodstream very, very rapidly. So it's the same thing if they're going to give that to someone who's having a heart attack and needs nitro. Think about what we're doing with our toothpaste or things that we're putting in our mouth. This is why, for example, tobacco chewing, prolonged cigarette, use can cause oral cancer, because it's destroying the mucosa of your gums. And so it's kind of very similar with our toothpaste. So it's one of those things that I kind of wish, it wasn't a Colgate Crest world out there. In dental school, that's all you get thrown is Colgate and Crest. They're the ones that do your lunch and learn. They're the ones that come in and, talk about their products. And so I think, there are some companies out there that are going to try to come in. They're a little bit all natural, but sadly, I feel like it's a very monopolized market. But I think we're slowly getting away from that as more and more dentists are kind of reaching out and understanding, hey, there are other much better options also out there. So that's a very good question. What are the pros and cons of teaching versus private practice? That's a really good question. So one of the biggest cons I have is when I'm teaching, I'm not doing the work. So I'm not physically, inside the patient's mouth. I'm working with the residents and helping to teach them and guide them. But from a physical standpoint of me being hands-on, there are times where I have to be, if there's a situation that arises where they need an attending to jump in, then it's me. But other than that, it's kind of the hardest things. You step back and you have to let the next generation learn and grow. And that's exactly what happened to me when I was a resident. I'm sure my attendings at a time were like, man, I just want to hop in there. But that's how you learn and grow. And that's part of the growth process in any residency. What I do love about teaching is just meeting different people from different walks of life who are my residents. I like the collaboration in kind of a school setting where, in our case, we have the orthodontist, we have the oral surgery, we have, endodontist. And so we do a lot of combined cases with them. I'm able to teach the residents about sedation, how sedation works. And so I think it keeps me on my toes in terms of what information and knowledge I need to be abreast with and how I can pass that on. A lot of times, no matter what institution you go to or what, kind of schooling you get, there's a lot of fear-driven learning. And one of the biggest things I've been trying to do is teach with love and empathy instead of fear and ego. And that's another shift that it's kind of been my vision, is that I hope there are a lot more younger attendings and younger faculty that go out into academia, regardless of the field, just so we can kind of break these stereotypes that, like studying is rigorous and it's brutal and it's rough. And sure, it's rigorous and it's meant to like push you and like, test you, but that's how you learn and grow. But I also feel that, hey, when you learn and grow through love and compassion, and you realize, hey, that like your teachers have your back and they're not shaming you, it's a whole different mindset. And so that's the one thing I really love about teaching, is trying to bring that type of mindset and trying to push that into the institution. In terms of private practice, I love being me. I feel like I can totally be myself in character. I'm talking to patients. I'm talking to parents. It's a lot of educating. It's a lot of talking. And it allows me to, like I said, I'm the superhero dentist. And I walk in like with my superhero mask on. I usually have superhero shirts on. And so there's no dress code like there is in an academia setting. So it's nice. I feel like I'm just able to be myself. I'm able to tailor my treatment to my individual population. And I love doing procedures. So that's the other thing, is that I'm totally hands-on, and I'm able to implement and use different materials and kind of keep up with my, my skill set on that front. So that's really neat. I like using the laser that we talked about, doing the frenectomies, doing all the different type of sedations. And so just being able to physically do that on your own and with your team, that's the best part about private practice, in my opinion. What was your average workload during dental school? I don't know if it's like you can say workload, because not like there's nothing that you can choose. It's kind of just the curriculum that you're given. So on average, like you might have like 4 major classes, and they're kind of, depending on where you go, they might be staggered. So you might have 3 classes that start one week, and then the second week you get like 2 more added in. And so that way, when you're done with, one of them, or done with the first set of them, there's another, 2 or 3 that get added on. So it's almost like a staggered system, but there's no technical workload. It's kind of just a curriculum that your school, has in particular to that institution. Do you believe that gap years are beneficial before going into med school, or in this case, even dental school? Yeah. So this is great. I actually, my brother, who's Darshan, was I think on here a few weeks back, and he's actually a PM&R resident now at Hershey. He took a couple of years on a gap year, and it's a great conversation that him and I always have. You grow so much, right? Having a gap year, there's nothing wrong with that. There should be no stigma associated with that. And this is kind of the barriers that we are trying to break. If you're in med school, or going into med school, or going into dental school, these are barriers that, I think that are starting to break a little bit more. I think what's more important is what you do during your gap year. If you're going to just sit at home, for example, eat potato chips and watch TV, probably your gap year is, not the best thing that could have happened to you. But if you get out there and you're a go-getter and you're trying to follow your dreams and your passion, you applied to med school, you applied to dental school, you didn't get in. That's okay. Every situation has a silver lining. And that's one takeaway I would definitely, use in every situation, because it applies in every situation. Every situation does have a silver lining. You may not see it instantly, but 2-3 months down the road, a year down the road, it'll come back and you're like, you know what? I'm glad I went through that. I'm glad I didn't get in, because I was able to explore and learn something else about my life, or I was able to travel and do something that I otherwise would not have been able to do. So it's what you do with that gap year that I think is the most important thing, but definitely should not be shunned upon. Does dentistry offer a good work-life balance, and what recommendations do you have for maintaining a good work-life balance? Yeah, so I think dentistry offers a phenomenal work-life balance. I have 2 boys, for example, 18 months and 3.5. I set my own schedule, and I've set my own schedule ever since I, started in the dental field back in 2015. I think that's the biggest thing, is that you're able to kind of dictate what you want to do, how you want to do. If you want to go once you become board certified, if you want to have OR privileges, you can have OR privileges and work in an operating room every now and then if need be, and see patients there. But the biggest thing is that you're able to just set your own schedule, obviously, and I'm hoping you're doing what you love, which is why you choose dentistry. I always talk about this at side. Is it lucrative? Like, yeah, it's lucrative, but that's not the reason you're going into dentistry, is, for the money. If you don't have the passion, you don't have the purpose, you're not, to me, the money means nothing. So if you work hard, you love what you do, the results will show. One of those results being financially, being financially well off. I do understand everyone wants to have a good income and pay off loans and debts, and obviously be able to use that source of income to further enhance your life. But don't go based solely chasing the money. But it'll come to you. It's definitely a rewarding field in terms of that. But I think the biggest takeaway is just kind of the autonomy that you have. Recommendations in terms of maintaining a good work-life balance. Yeah, just prioritize. Do what you do. Don't try. What happens a lot is when you graduate from dental school, or you graduate from your specialty, you start seeing like the dough comes in, right? And you're like, whoa, like this is real. This is legit. My first paycheck. And don't let it consume you, because after a while, guess what? It's going to become mundane. It's going to become very boring. It's going to become very jaded. So initially it's great, but have a good head on your shoulders, still enjoy, have a kind of a personal life, be able to do certain things that you want to do, travel, don't get sucked into the work because it will consume you. And after a while, a lot of dentists I know, they start off with a nice, good back, and over time, they hunch over like this. And so, like I said, in dentistry, having a back and having a good back and lower back is very important. So take care of yourself, and it's just a basic thing that applies to life in general. Eat well, sleep well, get your rest, and just if you're able to work out, even if it's not weights, but just taking care of your body, getting exercise, it's the most important thing. So just make sure you make time for that. Make you time, do you each and every day, so that you have that work-life balance. What's the most extreme case you've come across? Oh, that's good. That's good. It's going to be very dentally related, but I was in residency and I had a kid that had a ATV accident, and literally 3 teeth it was his upper left side. The 3 teeth all shifted one over, and one of the teeth went straight up in his nose. And we're looking for, they took a CT scan. No one could find it. And then all of a sudden, we palpated down his nose. I'm like, what is that pointy thing? It was his tooth. So I literally had to push his tooth back by pushing through his nasal bone and pulling the tooth out through the roof of the mouth, taking it out, and just literally rearranging all 3 teeth back into the appropriate spot. That was really cool. Oral surgery was busy with another case. And so that was something that we did. I said, I'm very blessed. I went to a fantastic residency that allowed me and gave me great training in certain, with these emergency cases. So it's one of those things where nothing really has phased me, so to speak. Everything's been a great learning experience, but that was probably one of the wildest cases I've seen. Got post-op pictures. We did everything. We made him one of the teeth he eventually ended up losing, but we made him a flipper and kind of like a fake tooth. And to see him from that moment, which we had pictures for, and I still have pictures of, to 9 months later, you would never tell this kid was in a accident like that bad. I mean, his gums cleared up real nicely. The teeth ended up looking great. He did need a couple of root canals, but I mean, before and after was, oh my gosh, a 180. So that was a really cool case. How has your family always supported you in your work and goals? Yeah, I would say my family has always supported me in my work and goals. Maybe I've been lucky in that case, or I've been blessed to have that. But like I said, if you're and I'm assuming that this person is asking this maybe because their family is not supporting them. And my answer to that is, if your family's not supporting you, it's tough, right? Because you might be dependent on them for you're probably dependent on them for money. You're dependent on your parents for 3 things. It's either money, shelter, and they also own you with psychological warfare, right? It can play mental games on you. But those are the 3 things that your parents have on you. And if you're able to step out of that and follow your dreams and follow your passion, that's the most important thing. So if they don't support you, just realize hopefully they come around, but don't let that be the reason that you're not following your dreams and your purpose, because you have your own life to live. Parents love to vicariously live through their children, but just do what you have to do. I can talk, like I said, if you have anything specific, shoot me a DM at the Superhero Dentist and we can talk a little bit more about that. What is your favorite part of my job? It's easy. I think just dressing up as a superhero and just putting the smile on kids' face. I think just having a child walk in tears and having them walk out with high fives. Now, given COVID, it's a lot of fist pumps and one of those, but it's still, I think, having a child who comes in very anxious, very nervous, and then walking out and be like, wow, I just did that, and empowering them to be their own superhero and having them have that sense of satisfaction, I am somebody and I'm gonna be somebody. And I think that's the coolest thing. So that's a favorite part of my job. What is a dental program like at the University of Pennsylvania? It's dental school in a nutshell. It's demanding. I think because it's Penn, I think a lot of the professors I had were very egotistical. I think you're going to get that in a lot of dental schools, especially quote unquote the Ivy League dental schools, if that's what they're called. I don't even know. I don't even consider, people go, you went to an Ivy League dental school. No, I just went to a dental school. I don't, it's close to home. I wanted to specialize. I knew that I had a good chance of specializing through there, which is one of the reasons I went there. But the egos are through the roof. I think the way that you'll talk to any dental student, it's it's part of, I guess, being a student. It can be challenging on that front, but it's awesome. Every school has its pros and cons. So the one thing I did like about Penn was that we have tons of different specialty. Like we have OMFS, we have like all those like specialties I talked about. I think we have each and every one of those, besides like a mobile dental anesthesiologist, but we do have an anesthesiologist that, I work with actually for pediatric cases. So I think we cover the whole gamut in terms of the specialties. So you're able to see a lot. Now, if you're a dental student, the downside is you're not able to do a lot. There's some students who go to different schools and they place their own implants. They might have done some of their own like gingival grafting and like certain minor surgery stuff. Because Penn has all those subspecialties, and because those are residencies and the residents are either, there for learning or they're paying money, those are going to go to them. So they're the ones that are doing it. And as a result, you're really not getting hands-on experience. You can definitely shadow and watch and soak in as much as you can. But in terms of doing it, you're not really going to be able to you're not going to get a chance to do much of it because it's going to those residents. So that's kind of like, yeah. And it's like any other school, the first 2 years are heavy didactic, heavy academia. The last 2 years, the third and fourth year, are very kind of clinic driven. The one cool thing I do like about Penn is in your first year, you're actually in the lab picking up a drill and drilling on the mannequins, which is really neat. Not that many programs have that. So if you want to get hands-on right off the bat, Penn does give you the opportunity. They just renovated their school, which is awesome. Everything always happens after I leave, but it looks really, really nice. Their school is fantastic. They really did a really nice job in terms of renovation and being able to give back and kind of hopefully make sure that their students take advantage of what they have to offer. For students who are in undergrad, what do you suggest we should do in order to stand out to medical school administrations? For example, hobbies, extracurricular activities, etc. So for med school, dental school, I think the biggest thing here is do something that you're very passionate about. My biggest thing is quality over quantity, which is what I touched on earlier. Don't spread yourself out so thin with like 6, 7, 8, 9 activities if there's no substance and the longevity behind them isn't there. I'd rather see you have like 2, 3, 4 activities that you're very passionate about, very determined, and can talk a lot to and talk a lot about. So I think biggest takeaway here is a quality over quantity. There's nothing in specific. Like I said, like a lot of people say, oh, I have to research and do that. If you're researching because you're just trying to get published and there's no passion, it's going to show through in your interview. So if you're into research and stuff like that, great. It's unique, sure. But there's so many things out there that are unique. Like, you could have like been abroad for 3 months, like hiking somewhere down in Peru and did like, Machu Picchu and like Inca Trail and doing all this stuff. And then went from there to Bolivia, went to Ecuador. I mean, and I'd be really interested to hear someone's experience with that. So I don't think it's just school driven. If you have, I say, work on building your life resume, right? Because that's what's going to carry you throughout life. So when I'm talking to somebody, sure, you're applying to dental school because you have the grades, or you have the DAT score, or you're into dentistry, which is what I expect, or which is what any person would expect. But what I don't expect is like that little secret thing about, oh wow, you did that like last year. That's really cool. Like that's different. So that's the way I would stand out. Be you and do what you love to do. Which classes were very hard that you've taken? I don't know. I think biochem gets really nitty gritty. It's hard. I think all the classes can be tough. There were some very hard classes. I thought anatomy was very hard. I thought biochem was hard. I thought physiology and pharmacology. But they were hard, but I loved them. Like I enjoyed them. I did well in them. But they were hard because just a lot of things you need to know. But it's cool because that they're hard because you're literally talking about the way your body functions, right? You're giving someone, let's say tonight you have a headache, you're taking Motrin. Well, how does Motrin work? Where is it going from here to down here? And then where does it go from there? And how's that working? Like what pathways are it getting absorbed by? So that stuff was really cool. I hated the Krebs cycle. Krebs cycle, you're never going to learn. You're never going to really use again in your life. I think whether you're in med school, dental school, it's like cool to know how things work. But in my opinion, I think there's things that are more functional and more applicable on a day-to-day basis that I love. So I love physiology. I thought it was hard because I wanted to know every little nitty gritty about, hey, like how does our body move? Like why does, if you're having pain here, how does that, what sensors does that send to the brain, and how does that translate back? So it's really fascinating, but I would say those are a few of like the more challenging ones, but at the same time, like the ones I really enjoy. Do you have any dental school horror stories? I think everyone has horror stories. If you haven't failed an exam, med school, dental school is going to be your first time for doing that. It just happens. It's part of the process. Or if you're not used to getting a C, you'll get a C. I mean, get it, get it out of your system, shake it off. You're totally fine. You're going to get through it. Biggest horror story though, I'd say, man, I don't know if it necessarily, oh yeah, it happened to me. I had a hard, I didn't fail. So one interesting thing with me, I actually didn't pass my boards until the third time around. So that was like my biggest challenge in dental school and my biggest horror story. So we took the written boards. I didn't get through it the first time. And I found out in August. Then the second time I took it, I found out I didn't pass on my birthday, which was the worst birthday of my life. And then I took it the third time. And the different thing I did here was I was like, I'm just going to be me. So I'm going to go to the gym. I'm going to work out. I'm going to eat well. I'm not going to stay up until 3 o'clock and then wake up at like 7. So I got good sleep. I ended up going to bed at like 10 o'clock 9, 10 in the evening, waking up my usual time. And I felt great. I just felt more mentally alert. And so it's funny that like this misconception that, hey, like pulling all-nighters is awesome. Pulling all-nighters wreaks havoc on your system. It's really not good for you. There's a really good book out there called Why We Sleep by Matthew Walker. He's a PhD and he's awesome because he does a lot of research and he has a lot of research that backs up why sleep is important. Regardless if you're in medical school, dental school, it's a good book, I think, just for everyone to read on just the importance of sleep. But that's a great book called Why We Sleep by Matthew Walker. And I realized, hey, I just got to get back down to the basics. And I kind of deviated away from them the first and second. First time, I think it was nerves, maybe a little bit of like overconfidence and, like, this can't be that bad. Second time, I think I just went too hard and I burnt myself out. And third time was, in a way tough because my back was against the ropes. And if I didn't pass, my dental school journey would have been very different. I may have, had to repeat a year. But I think the biggest thing was that when I got through that, I realized, hey, I can do anything. I just need to stick true to who I am and what I do. And for that, that'll be different for everybody. Some people, may want to watch, need a break, or some people, need to work out. It's going to be individualized, but just be yourself and keep to your routine and stay grounded, whatever that means to you, and however you have to stay grounded, stay grounded. So that was what I say. That's my biggest horror story. Thanks for taking me back there. Just kidding. It's very important to talk about because I think everyone's going to have failures, but it's how you overcome them. That's the most important. Do you record being a regular hygienist or go into a specialty? Do you recommend being a regular hygienist or going into a specialty? Once again, it's up to you. Up to you what you like. If you like working on adults and adult teeth and you don't want to deal with like sometimes a crying kid or a difficult kid, then you can be a hygienist, an adult hygienist, or work in an adult practice. If you like working with kids, or if you like surgery and you want to be a hygienist or an assistant in a different field, it's just all to your liking. So there's no right or wrong. What I recommend is what makes you happy and where you see yourself as a good fit. If you could change something about the practice of dentistry, what would it be? That is a fantastic question. Ooh. Man, that is really good. That's a really good question. Practice of dentistry. I'm gonna have to think about that one. That's good. That's a loaded question. I don't want to give I want to give a really good answer for that and something meaningful. One of you guys remind me. If I don't answer that, remind me by the end of tonight's session. What if there's something I could change about the practice of dentistry, what would it be? Great question. What is one of your favorite memorable cases in your career so far? I'd say the one that I talked about. I'll never forget that. My trauma by myself, doing that, at like 2:30 in the morning. That was definitely memorable. The other memorable case I had was actually earlier this year, where I had a little boy who had a very difficult speech issue and hard time talking because he had a very, very strong tongue tie. Not all tongue ties need to be released, but in his case, he needed a release or revision of his frenum. He came with his dad, and why this is meaningful is because his dad like literally broke down and started crying and was like, Dr. Shah, I don't know what to do. Like I'm not going to give his name, but he doesn't like me anymore. He'll say something and we're driving the car and I'll say, what'd you say, son? What'd you say, son? I'll say it 3 times. At the end, he'll be like, forget it. Like, I hate you. I hate all of you. You guys, I don't want to live here anymore. And I think child was borderline suicidal, and we were able to do the tongue revision. His speech improved probably in about a month and a half to 2 months. He was working with like a myofunctional therapist as well. And I saw him back a couple months later, and to see dad break down to tears, this time tears of joy, was priceless. And to say that, hey, his son's doing so much better. They've become a family now, and they all enjoy dinner. They all laugh a lot at the dinner table. They can understand what he's saying. He feels confident. He's not getting bullied at school. So the psychosocial aspect of dentistry can be so rewarding, especially with children. So I would say that's probably one of the most impactful cases that I've had as well. How has COVID affected your work, and how have you adjusted? Yeah, that's great. It was tough. We didn't work for about 3 months. It's very tough because we work in the mouth. So one of the highest, if not, yeah, they were probably one of the highest, risk groups out there because of the proximity to the oral and nasal cavity. And so right now it's definitely changed. I mean, I'm wearing an N95 respirator when I work. It gets hot, it gets heated. In terms of patient flow, we initially went from 30-minute appointments for our hygiene patients to 45, to let all the aerosols kind of trickle down and clean up. Now we're back to the normal schedule. But I think just, it's gotten better, but I think just in terms of taking things for granted, right? I think we've always been dealing with pathogens, especially in the dental field, for as long as I can remember that the field has been in existence. But I think just to realize that, hey, like the severe magnitude and gravity of what's going on, and just kind of slowing things down. I think that's kind of been the biggest thing, is everything's just slowed down a little bit. So you're not kind of going boom, 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 boom. There's a lot more checks and balances. The wait time, I think the interaction with parents is definitely a lot more different. Our waiting room is completely closed off. So parents are coming in their cars, they're texting us, and then someone's going out to receive their child and then bringing them in. So small things like that, having a waiting room full of kids playing video games. And that's the one thing that I really loved about the practice I work at, is that we had a huge arcade in our waiting room. And so kids loved it. It's a great way to calm their nerves and to help them before their appointment, or it gives them something to look forward to when they're done with their appointment, to go back out and play. And so not to have that is definitely a little difficult from that standpoint. What did you major in? Do you think being a business major would be okay? Yeah, so I majored in biology, but I did a minor in business administration. I think being a business major is awesome. I think the entire world runs on business. So I think it's one of the most applicable majors to have. Learning the actual medicine or dentistry, like med dentistry, whether you're in med school, dental school, a lot of those courses are the same. You're going to be taking biochem, you're going to be taking human physiology, you're going to be taking all these courses. Let's say you are a bio major in college. You might benefit from everything you've learned for like maybe 2 or 3 lectures of one course, not even the entire course, because the amount of detail that you're going to go into, for example, in dental school, is going to talk about the particular dental genome, the particular dental biome. And you're not going to learn that in undergrad. So sure, you might have, if you have a bio background, you're like, oh, I can kind of relate. And you might feel like you're ahead of the 8 ball, and you very well could be for the first like 2 or 3 lectures. And then after that, you guys are all together. You and your classmates, you guys are all on the same page, because that's where the material just gets a lot different and a lot new. So my thing is that, hey, if you want to go be a different major, do it now, because it's the best time to explore something. Because then other than that, I mean, whatever you're going to do, dentistry or medicine, it's going to consume you for the rest of your life. So if you want to like minor or major in something else, go for it. I think as long as you meet the prereqs that you need to get in, I think that's the most important thing. But if you're going to adventure, do it now, and do something else that really drives your passion about. The dentistry always interest you? No. This is a bit random, but I was wondering why taking out a cavity hurt so much. No, growing up, I actually wanted to be a neurologist. No idea why. I just thought it was cool. I loved the brain. As I got older, I realized that the brain is the only, and the mind is is the only organ that we ask to like learn about itself, if that makes sense. Like, for example, if we're going to read about like learn how to like how the arm works, we use our mind to like learn about every other part of the body, but now we're also using our mind to learn about the mind. And I think that's so fascinating how there's still so much research on brain development, Alzheimer's, all these things. And so I think that's why initially I think neurology, neurosurgery interested me. And then I just realized I didn't want that lifestyle. There came a point where I was like, I'm not gonna like do this for 10 years, and I want to have a comfortable lifestyle. Some of the things I talked about earlier with the questions, the autonomy, the instant gratification, and that work-life balance is what I wanted. And that's kind of the reason why I end up going dentistry. In terms of why taking out a cavity hurts so much, it shouldn't hurt. You should get numb. Hopefully, you're not having a procedure done without getting local anesthesia. And if you're getting local anesthesia, there are certain techniques, and hopefully you're just getting the right amount of local anesthesia as well. So, but technically, a cavity should not hurt. I know. So, everyone talks about like, oh, I'm going to a dentist, I'm scared, but besides the numbness, that's what we give local to make that appointment as smooth as possible. So, yeah, reach out to me and let me know your particular situation at the Superhero Dentist. Once again, on Instagram, I'd be more than happy to, we can talk a little bit more about that. What's the best way to whiten your teeth? Great question. I would say the most efficacious way is if you're able to actually go to your dentist. They have, we're on Zoom. They actually use a machine called Zoom. So it's like a Zoom whitening system. And there are probably different ones out there as well, but it's an hour-long appointment. And what they do is they dry your mouth. They kind of put these retractors like this. Your cheeks are even wider, and you're almost like, cheesing real hard, but it helps to kind of open your teeth and kind of helps retract the gums. They're going to dry everything off. And then that way, they're going to put this gel on your mouth, on your teeth. They let it sit for 20 minutes. You do that 3 times. That's what really, really whitens your teeth. That's the best, most efficacious way to do it. Second best thing is if you get like whitening trays, customized whitening trays. So you go to your dentist, have them take an impression or a mold of your teeth. They'll custom make a tray that way, and they'll give you some whitening material or whitening gel that you can put on there, and you put that in, and that customizes everything. Last option, which also works really well, you just might get a little bit more sensitivity because it's not a custom fit, are those over-the-counter whitening strips, so to speak. Those can be a little bit bulky, and so it can kind of cover your gums, and so you can get a little bit more gum or gingival irritation, with those, but they do a really good job in terms of like how they work. You just might be able to have a little bit more irritation, and also the percentage of whitening on them is not the strongest. So the most efficacious is definitely having it done professionally. What toothpaste or product do you recommend to clean our teeth? Another great question. So I have a whole list of this I can talk about this for hours, but check out at the Superhero Dentist. I actually talk about like ingredients to avoid and products that I recommend. I'm actually going to be posting something quite soon in the next week or two, a recap of my favorite products out there. But in a nutshell, for adults, there's something out there called Risewell. Big fan of Risewell, and these are all like natural toothpaste. They're great. They're not only are they like less harsh. I mean, they're not harsh at all because they're so like kind of natural, but they also do a good job in terms of fighting bad breath, and do a great job in terms of cavity protection. So Risewell is one of them. Another one's called Coral, Coral. There is one called TheraBreath, which is another good one. So those are the three that are top 3 in my mind. There's another one called Twice. Sorry, that actually just came out. That's a great brand as well, Twice. So those are top 4 that I can rattle off the top of my head. I have a whole lot more, like I said, on my Instagram page. I'll be actually posting on this soon again with just an updated version that talks about, hey, toothpaste with fluoride, without fluoride, and kind of like there's a whole other controversy with that. But I'll save that for another time. Was residency in this field very strenuous? I wouldn't say it was very strenuous. I would say so when you go into a pediatric specialty, and if you're choosing to go into pediatric dentistry, there's one of two pathways you can choose. So we're a dental school here, and you can go one of two ways in terms of your residency. You can go to a university-driven school, or you can go to a hospital-based kind of program. I went to a hospital-based program. So we worked out of the hospital. We shared the same suite with plastics and with ENT. And I thought that was incredible because I learned so much from those guys. They were like a wealth of knowledge. Then the university-based one is in a university. So it's like at Penn, where I'm teaching right now. Those residents are university-based. They work out of the university. With the university-based, you're paying tuition. With the hospital-based, you're getting paid. And that's why sometimes the hospital-based ones are so much harder to get into, because everyone wants to go this way. Everyone wants to get paid if they can rather than paying a tuition. But we learned a lot. You're on call a lot more. You're in the hospital, so you're seeing a lot more, different cases. You're working with hematology, oncology. You're working with podiatry. You're working with speech, with audiology. So you're working with a lot of different fields, ENT, plastics, like you get a whole gamut of different things. And so as a result, the breadth of knowledge that you undertake is quite a lot. And sometimes, the expectations can be a little bit more too, which is not a bad thing. But I do think, like I said, I do think depending on where you go, and the call schedule, the amount of residents, there's a lot of things that play into this. But if you go to a program that has 10 first-year residents and 10 second-year residents, so 20 residents, you may not be on call a lot, which people are like, that's awesome. Like, I'm not going to get called in late at night. But like I said, in the moment, it's great. But when you want to step out, what you're doing when you're in school or when you're in residency is you're setting a foundation for the rest of your life. So when you come back and I look at where I went, 5 years ago, I'm so glad I had the experience that I did, and I was on call and I saw some of these crazy cases, because it's laid a foundation for me in terms of what I'm able to do and what the expectations of myself are, and what I can handle and what I'm comfortable seeing. And so in the moment, it might sound like, oh, like this stinks, that we do a lot of call. I'm so busy. I'm getting called in at this time. Oh my gosh, I have to go, do a combined case with this subspecialty. But I'm telling you, like, once you get out of residency, like, that's it. That's the foundation that you're kind of, that you're in an institution that's helping drive your foundation for the rest of your life. After that, it's all just self-growth and self-development on your own. So, yeah, I would say it was a bit strenuous, nothing crazy, but I loved every minute of it. Did I need to take out a lot of student loans for dental school? Great question. I personally did not have to. Nowadays, it is crazy. There is, if you guys, like I said, if you follow, his name's Paul Goodman. He's like the Dental Nachos. It's a Facebook group called the Dental Nachos. Check it out. He's great. He talks a lot about, like, a lot of information for prospective dental students, in terms of like debt, in terms of, hey, how to choose the right dental school, like what to look for, and putting you in contact with people in these different, areas. Like if you're going to a dental school in the Midwest or in the East Coast or West Coast, and that particular school, what the tuition is, how is the school structured. So definitely a great source, a great resource I would tap into. What products do you recommend to whiten teeth? I just went over that, not too long ago. Is this going to be recorded? Yeah.
Yeah.
So, yeah. All right, cool. Yeah, so I'm not going to repeat that just because we just went over it, so I don't want to beat the dead horse on that. But if there is the name is carbamide peroxide is the whitening agent, and that's the whitening agent that you're going to use. So here's the next question. This may be off topic, but where should you look when getting your teeth cleaned? I feel like sometimes dentists don't want to be stared at, but there's no where else to look. Where should you look to get your teeth cleaned? Little confused. I mean, I guess the dentist is where you should go to the hygienist. I mean, the dentist office where you should go to get your teeth cleaned.
He meant where do you do you look in front of the dentist? Do you look up to the left, right? But like that's kind of an inappropriate question.
Oh, okay.
I'm not gonna lie.
I gotcha. Yeah. No, I mean, you're gonna listen to a direction of your dentist or the hygienist. Sometimes it's to say if they're right-handed, they might have you turn their face, their head to the left or head to the right, depending on the areas of the teeth that they need to get to. But I mean, like, yeah, that's gonna be a little. It's gonna be on the provider. Thanks for the clarification. Does brushing with baking soda help whiten teeth, or does more harm than good? That's a great question. Baking soda can help whiten teeth. I just have found that some of these more natural toothpaste just do a much better job in terms of whitening the teeth. So like I said, check out like some of these, some of these toothpaste that are all natural. They're the best ones. I just alluded to a few of them a couple minutes ago. Baking soda, like I said, doesn't hurt. Can it be too abrasive? It can be. And if you're brushing too hard, it can cause, can do more harm than good. So I've come to the assertion and kind of the realization with just my own patients that I've seen that what switching them from a Crest or a Colgate or an Arm & Hammer to something a little bit more natural has done a much more efficacious job, not only in terms of just whitening, but also in terms of like soothing the gums and helping reduce gingivitis. All right, due to limited time, we'll be ending the Q&A session.
Also, I believe Christy knew Yen's question. If you could change something about the practice of dentistry, what would it be?
Yeah, great question. If there's something I could change about the practice of dentistry, that's like such a good question. I've been thinking about this the entire time too. I don't know if I can pinpoint one particular thing, but I just kind of wish, like in dental school, I wish it was, less biased. I wish there was a way, and it's a great question, but it's also one that's impossible for me to answer. In terms of dental school, I wish there was a way for schools to be less biased and for, students just kind of get a whole exposure to everything. Like I said, Colgate Crest dominates a lot of the market. I wish there was a lot of other things to talk about. I wish there were other toothpaste products that were brought up to the front light, to the limelight, so to speak. Training can be so different, depending on where you go for dental school, depending on where you go for residency. Things can vary so much and things are not very standardized. I went to a program that, in terms of our requirements, we'd do like 25 cases of sedation. I think I did like 250, 300. And there are programs I know that are barely getting to 25 and barely making it. And so that like discrepancy right there is huge, especially if you're entrusting your child, entrusting a doctor with your child's care. You want to make sure that, or any provider, either if you're going to I always say whether you're a doctor or not, at one point in life, we're all going to be patients. Even doctors go see other doctors for appointments. So you're still going to be a patient. You want to go to a provider that, knows what they're doing, or you feel like has gotten a good training in what they've done and is able to, do things that like, I guess, the highest standard. And sometimes I feel like that standard can vary. It's not just in dentistry, but throughout any field. But I can definitely talk about it more in terms of dentistry because of what I've gone through, because of what I've seen. So I think that's one of the biggest things I would change is kind of like that the level of playing field. I wish everything was a lot more standardized. And some people say, oh, it's here. I wish everything was just like right here, because standard of care should always be up top. So we're not going to meet in the middle. We're just going to elevate every single program. So it's up here. So care is impeccable. But it comes with resources, comes with location. And the uniqueness of every program obviously kind of supersedes some of those things. But I think that in a nutshell, probably one of the biggest things is just kind of care and access to care and who's able to get care. But that's a very, very good question.
Okay, thank you for joining us today, Miss Dr. Shah. And thank you for sharing all the nuances of dentistry and answering all the students' questions. And thank you everyone for joining. Since it's already past our 9 o'clock meeting time, we'll be ending the Zoom meeting. Thank you everyone for joining, and thank you, Dr. Shah.
Absolutely. No, thank you guys for what you guys are doing. This is awesome. I have seen some of your previous videos with all the other providers. So what you guys are doing is awesome. Keep it up. And thank you for having me.
Thank you.
All right. Take care, guys. Stay blessed.
Yeah.
Bye.